than 4 million unique users. I'm your host, Gary Baumgarten. Well, you know, we talk about a lot of serious issues here on Pal Talk, and on Fridays we like to lighten it up just a little bit. So we decided to do a show called Beauty and the Beast. Beauty and Boaz. Boaz is the beast. What, you think I was going to point at myself, Boaz? Come on. Anyway, it's appropriate to talk about that because everybody seemingly is obsessed with his or her appearance. And so we thought we'd have Dr. Jennifer Walden join us. Jennifer is a plastic surgeon, and she understands the patient's desire to maintain a healthy and attractive appearance. She's board certified by the American Board of Plastic Surgery. She specializes in aesthetic surgery of the body, breast, and face. And she has a special interest in aesthetic breast surgery, known for her large volume of work in breast augmentation and breast lift surgery. She is, as you will be able to gather, the minute she opens her mouth, a native Texan. She received her undergraduate education at the University of Texas at Austin, graduating with honors with a Bachelor of Arts in Biology. She received her MD, specializing in plastic and reconstructive surgery with the highest honors, graduating from the University of Texas Medical Branch and a member of the Honor Medical Society. She began her training at the University of Texas, and after completing her residency training, she moved from Texas to New York to pursue her special interest in aesthetic surgery. During her highly coveted fellowship at the Manhattan Ear, Eye, and Throat Hospital, in private practice here in Manhattan, she remains an associate attending in the Department of Plastic Surgery at Manhattan EENT and at Lenox Hill Hospital. Now, she's in high demand by the media, both print and television. She's been featured on a recurring basis on Fox News Live, talking about such topics as celebrity plastic surgery, soft tissue injectables, and many other issues. She's been on 2020 on the CBS Early Show, and now the pinnacle of your media experience. Here you are on News Talk Online on paltalk.com. Welcome to the show.
Thank you, Gary.
Why are so many people so concerned with their looks?
Well, I think it's a common thing for people to think that means every person.
Barry, please adjust your mic. Okay, put that closer to your mouth.
Yeah, I don't think that
there we
means,
go.
Just because we're concerned with how we look and our outward appearance, it doesn't mean we're vain or that every person is seeking a procedure. And certainly we screen people for certain procedures in plastic surgery, but it's just a fact of life that looking better makes you feel better, looking healthier and feeling healthier is just good for you and for your life.
And it's whether we agree with it or not, people could call it vanity or not. The way people react to us is a lot based on how we present ourselves.
Absolutely. Outward appearance has a lot to do with how people respond to us, react with us in the workplace, in our personal lives, and that's just something we can't really lie to ourselves about. It's a fact of life, and so that's where we come in and we can make recommendations to do things or to not do things based on that.
There's a lot of interest in your specialty. There is a series. Is it still on television? The fictional series, the plastic surgeon, Nip and Tuck.
Right. So there are a lot of plastic surgery shows on now. Nip Tuck is the fictionalized version, and it gives plastic surgeons a bad rap, really, because I think I've quit watching it with the first couple episodes that I watched. The plastic surgeons were sleeping with their patients and removing someone's face to put a new face on. Drug smuggler, and it's really misrepresentative of our specialty, and so I don't watch it anymore. But it's interesting.
But is it the Discovery Medical Channel or the Learning Channel? One of those channels, they have a show where they actually show the surgery.
Right. Discovery Channel has very good, legitimate shows that show surgeries from start to finish, and a lot of reconstructive surgery as well.
So let's talk about the fictionalized extreme. We saw it in the movie with John Travolta and Nicolas Cage, where they changed. You can't do that, right? You can't make me look like Burt Reynolds or something, right?
No, and that would be a red flag if someone came to us saying, I want to look like Brad Pitt. You know, MTV's had a show called I Want a Famous Face where there are two twin boys that wanted to look like Brad Pitt. And that's not a reasonable expectation for most men. And so that's really a red flag if someone came in saying, can I look like Burt Reynolds or Brad Pitt? And we would, at that point, probably decide, you know, we counsel the patient, and you might not necessarily do surgery on a patient like that. Most people that seek plastic surgery today are realistic. They have realistic expectations. They've done their homework, and they're actually pretty normal.
So what kind of reasons do people come to you? Just to get a little slight augmentation of their looks, generally?
Right. It's usually they have a specific anatomic complaint, whether it's a bump on their nose or they've been flat-chested their whole life and are tired of looking like a boy and so they want a breast augmentation, or they have isolated fat deposits and want those liposuction. There's usually a specific complaint that they want addressed, and not a you know, over-the-top extreme makeover. That's actually something that the media is somewhat generated with their shows, to get, you know, 7 different procedures, dental veneers, and change your hair color all at once. That's really not representative of what's going on out there for most plastic surgeons.
Does liposuction actually work in the long term?
Sure, absolutely. As long as you maintain a healthy lifestyle of diet and exercise, and you don't put the weight back on, then it should work.
But are people putting the weight on because they are genetically predisposed, or are they putting the weight on because of poor habits?
Most people for liposuction should be good candidates for the surgery, meaning their BMI should be within a certain range. And if they have isolated fat deposits, which are usually genetically predisposed to that, and they can't get rid of them with diet and exercise, that's when liposuction works. It wouldn't work on someone who's 300 pounds that we're trying to get rid of 100 pounds on. That wouldn't be a good surgery candidate either.
Now, some people, I just don't understand it. My ex-girlfriend's sister had, I thought, and I said it to her, your sister has the most amazing breasts I've ever, and she went and her boyfriend paid for an augmentation.
Now, did you see them?
Well, I mean, I'm not saying that I actually saw them, but I mean, you could tell when you look at a lady, right? And why would a gal that's just, you know, or somebody who has a beautiful face, they want a nose job or whatever? I don't quite understand why somebody would do that.
Well, I think a lot of women that come in for breast augmentation, they may, first of all, they may not be completely happy with their breasts for one reason or another that we don't know about. A lot of women have just a general asymmetry of their breasts, and no one's going to detect that in a cleavage-enhancing bra. And so they may want implants to help correct that. They may have something that we're not seeing. And so if you had absolutely beautiful breasts that were a perfect size, then